Good evening, everyone. I'm Colleen Christmas. I am the current governor for a few more months of our Maryland chapter of the ACP, joined by my wonderful colleagues tonight to talk to you about the nuts and bolts of putting together posters and abstracts. We've done this session every single year. Our students and residents who join find it really, really helpful, and we're delighted that all of you are here. Um, just a sense of how the evening's going to go. We're going to start with Doctors Chow and Jung to talk about um, the clinical vignettes, both the posters and the abstracts. And then we'll move on to Dr. Deepak and uh, uh, Dr. I'm sorry, Paudel. Sorry, I wrote your name wrong on my piece of paper. I knew it was wrong there. Dr. Paudel will talk about research abstracts, and then Dr. Weissman and Dr. Bhutani will talk about research posters. We'll have some time at the end then for Q&A. While our presenters are talking, though, please feel free to put things in the chat. I'll be monitoring the chat and trying to answer, and anything I can't answer, I'll make sure that we speak up and get the presenter to give us an answer to as well. So there's a couple of different ways for you to interact during this session. Hope that you find it helpful. I'm going to keep us on time. I do just want to put in a quick plug, a little reminder that we have our Williams Student Conference is on Saturday, March the 7th. And so that's at University of Maryland, Midtown. And we have our residence conference is on May 9th, I think. Give me 1 minute.
7th.
May 7th, is that right? Thank
7th.
thank you thank you so much. I don't wanna tell anybody the wrong date. May 7th, and that'll be at St. Agnes. More information to follow about that. So without further ado, I welcome our first speakers, Doctors Chow and Jung, to talk about the clinical vignettes.
All right. Hello. Can everybody hear me?
Wait, we should just introduce Dr. Deepak, though. Dr. Deepak just joined us. She's the incoming governor of our esteemed chapter. And wait, Dr. Deepak, say hi.
Hi, everyone. Sorry I was late. I went spinning and I nearly thought I'm going to die on the road today. I apologize for the lateness because of that. So great. Glad to see everyone. Excited to be here.
All right. So I'm Dobbin Cha. I'm excited to participate in this little mini session. Hee-Jae Jung is one of our chief residents, and he's, of course, going to do the yeoman work here, and I'm going to cheer him on. Hee-Jae, go ahead.
Thank you, Dr. Chow. Hello, everyone. I'm Hee-Jae Jung. I'm one of the third-year chief residents at University of Maryland Midtown campus. So let's get started. We will be focused on the clinical vignettes surrounding poster presentations. All right. So if you look at the first slides, but I want everyone who's participating to kind of think about what do they think about this poster. Any thoughts?
You can enter in a comment or two in the chat. How's that? You love it? Don't like it? Okay. Good. A lot of good comments there. Hee-Jae, go ahead.
Yeah, like it looks like everyone thinking a little bit similarly. Like the poster itself is very crowded. You can barely see the words. Really can't really make out like what it's really trying to present. The images itself, the bottom images are quite stretched. You don't know which one to focus. So maybe the CAT scan is maybe too small. It's just overall a very crowded poster, and it's very difficult to follow. You want your poster to have good flow. It should kind of pop out, and like easy to read. Like you should be able to see the keywords. You should be able to know where your eyes should be going, and it should be much more concise than this. Okay, so if you would like to improve other than changing the font size, maybe reducing some of the information, you guys have any suggestion for like improving this poster? You guys can type in the comments or kind of talk. Any suggestion on how to improve?
I'll throw my 2 cents out there. I say more with less has always been my theme. And strive very hard to chop up your words and make every word count.
Thank you, Dr. Wiseman. Yeah, like make it much more concise, fewer words. Maybe in bullet points can help. All right. So we're
The
gonna go
other-
on. Hmm?
Sorry. The other thing I would say for imaging, like if you look at that CT chest axial image, there's a whole bunch of the whole gantry and everything in that image. So you can cut all these images and only focus on the important part of the image. So that also helps a lot.
Thank you, Dr. Deepak. Yeah, definitely. We don't need to see all the extra things around. If they want to just focus on the mass, they should kind of cut this central portion out and blow it up to make it pop up more, or even add some arrows to kind of point it out. All right. Somebody commented why there's 2 reference sections. That's also a very good point. If we go on to the next slide. All right. Any thoughts on this one? Okay, we have a few comments here and there. Okay, I see a lot of comments on the font, but how about like the wordings? Like anything to comment in there? Okay. So I think everyone's also kind of thinking the same thing. Maybe they could um, use less words. Although they use bullet points here as well, maybe it should be more organized better. And yes, somebody commented on the figure captions. So when you are using figures for any academic poster, you do want to label the figures very accurately. So this is a very broad. MRCP suggests a PSC, and then there's just like 2 pictures. It should have been more of, they should have put this and this picture on the same, and at the bottom they should label like figure 1. MRCP suggests a PSC, and maybe a little bit of label there as well. Maybe they should have had arrows here and there to like kind of point it out, or maybe it was the presenter who was going to point it out while they're presenting. But like same for the bottom 2 slides as well. For this picture, it will be like figure 2 with upper GI, and then this could be going under the figure as like an information point. Same for this as well. So those are just some professional labeling things that you want to follow. Another thing I want to kind of point it out here is, although the poster title looks pretty good, it looks interesting, right? But it doesn't really give you what this poster is supposed to be about. Like it should have a good take-home message. Like if you just read the title, you should have an idea of, oh, this poster is about this. I should change my This information is new to me. I will change my practice. It should give you an idea. Of course, there's also some design issues with what's up with the two white boxes juxtaposed to each other. Maybe they could have made it into one large white box. Maybe the color scheme is not the best, but I'm not a designer, but it's not the most appealing color scheme there is. So maybe those are just some of the things that you might want to be mindful of when you are kind of designing your posters as well. Another thing I want to point out here is if you look at what they wrote, they use a lot of acronyms. ALP, ASD, ALT, ASMA, IG4, Pianca, MRCP, PSC. Although you would assume that most people would know these acronyms, it is best practice in any academic writing, including posters, to spell out the full name before and put in parentheses before you start using any acronyms. So if you're like writing ANA, you want to spell it out, anti-nuclear antibodies, parentheses, ANA, and parentheses. And what does plus V mean? Is it like positive? Is it talking about titer? Is it like strong positive? Is it 1 to 80 positive? Things like that. So those are just some of the, and as Dr. Christmas also mentioned, usually, yes, you do want to put in the official units of like, is this like milligrams per deciliter? It's like serum creatinine is 3.01. Is it like millimoles, milligrams per deciliter? Like depending on where your background is, some countries use different scientific units compared to the United States. So depending on your audience, you might want to clarify that. So it's always good practice to include the official units as well. So it's just like very simple little things that you might miss, but it's important to include in your posters.
And I think it's important to tell a story and to have the story flow. So to have that last bullet point, 2 admissions in the last 6 months, kind of is not in the right order of events, it seems, to make it more seamless.
That's also a great point, Dr. Wiseman. Yeah, definitely. They could have also made this more chronologic in order. That would have given us a much better picture of the patient's presentation and like the order of things happening, which we'll demonstrate in a later poster down the line. All right. We'll go on to the next.
Can you go back there?
Sure.
F1. Okay, so you've got a great case, right? And you want to make a poster. What is the purpose of doing the poster? Why are you doing this? What is our goal? Our goal is that someone comes up to the poster, they look at it, and they say, "Aha!" And they're going to go back home, and they're going to change how they practice medicine based on the information transmitted by your poster. I mean, that's the goal, right? And you want to be transformational. Now, there's got to be a take-home message, a learning point, and I'm not sure what the learning point is here with this. What are they trying to communicate here? It's not clear to me, and so that leaves the person looking at the poster, leaves them a little bit they're not satiated. So think about that as you go through to create your posters. You want the reader to have a take home message that's gonna be game changing. That's gonna affect how they practice medicine. Okay, so with that in mind, let's go to the next one. And am I supposed to discuss this one, EJ, or is this you?
I can discuss this as well, Dr. Chow.
Okay, all right. But I do like there's a lot of unusual things about this, but I do like towards the end they have some learning objectives. These are take home messages. Hopefully, these are things that someone who reads the poster will go home. Now, you're assuming that the poster logically leads into these objectives so that they're believable and they're logical. But go ahead, EJ.
Sure. I guess for this poster, it's a little bit more organized. Maybe use some more bold points. Maybe still a little bit crowded on the case discussion. Maybe they could have made it much more clearer on this presentation. But like the main thing that I want to discuss on this poster are the two big pictures they put on the left side. So these will be background information, mainly on Cushing syndrome and adrenal insufficiency. And the question would be, would you need these figures? What is your, if this poster was mainly presenting to medical students, then maybe this can be helpful as they might not know like the clinical manifestations of adrenal insufficiency or adrenal cortical excess. But if this poster is going to be directed towards many residents, fellows, or like beyond, like would you need this area? Would you use this area to put this information here? While you can probably, yes, Dr. Deepak mentioned that it could be put in as like a QR code to use less space, and you could probably expand this section to maybe blow up the pictures or make the case discussion more clearer, or like put the conclusions, organize it better. Thank you, Dr. Christmas. Yes, there's also a lot of information that may not be necessarily useful in this presentation, like how to taper steroid doses. It could have been just summarized with, oh, the patient underwent steroid taper. Like you don't have to, there are some details that you don't have to always include. Yes, labs can be organized into a table. That would also quite help. Like in the center, with a clean table, it'll be able to kind of pop out, oh, these are the important labs that we have to know about this patient. Clear to read. All right. And for the next slide.
Okay, so the purpose of this slide, we're coming to the end here. It's just to point out that and you all will have this. You all will have cases with complicated, long hospital course, and you're gonna be challenged to figure out how am I gonna describe a month-long hospital course. So this is use a timeline. So this is, now you see how this poster, instead of things being organized vertically, it's organized horizontally, and there's a timeline here, and each point in time where something happened to the patient, then they describe it in a little bit more detail below the timeline. So it's just a option, that's something to think about. It's a tool, and and it helps you as you're presenting the poster. You can point to the timeline, point to the progression of the patient's illness, and it helps you sort of organize your presentation to the team. Okay, and then next poster is what do you all think about this? You all thumbs up, thumbs down? What do you all think? So yeah, it's a technique, it's a tool. I'm not necessarily advocating for this, but if you go to a big scientific meeting, like Dr. Deepak goes to these meetings where there's tens of thousands of people and there's 500 posters in a poster session, and you walk down the aisle, and you can't read 500 posters, but your eye might get caught by this, and you get drawn into the main message, the take home point, and if that take home point is interesting to you, then you might walk over to the poster and you say, let me look into this. Let me learn about it. It's something that it's a technique. This resident was very he liked I thought it took a lot of space, and it really hits you in the face, right? It smacks you in the face. You're in fact you get a concussion. It smacks you in the face in the head so much. But it's something you might think about. Well, what I do like here is they did what TJ mentioned is they labeled each figure. So there's A, B, and C, and then below it says figure A, figure B, figure C. So each of these figures are labeled. What would be better? What is that in your description on the side, case description, you'll say 5 days before admission, see figure A, and then later on in the hospital course, see figure B. So you know when to go look at these figures. Otherwise, as you're reading the case description, you're reading the discussion, you don't know when you're supposed to go look at these figures. So your brain will randomly just go look at the figures, and then it's not you're not the thought process is not in the same vein as the author intended. Okay, so I think our time is up. Is there any last questions? Anything you want to comment on?
We'll have time at the end for more questions, but certainly go ahead and throw them out. I do just want to emphasize something that Dr. Chow just mentioned. So, know your audience. So, when you are presenting at the Williams Conference or the Mulholland Muller Conference, we have a group that's going to come around to your poster and give you a certain amount of time to go through and talk. When you're at these big national meetings, people will kind of mill through. You might not have anybody come to your poster if it's all wordy and detailed. And so that's why that last one actually is a good approach when you're really trying to grab someone out of the crowd to come look at my poster. It's grabbing, it gives you the headline right away. And then once they come up to you, then you give them the presentation, you talk them through the other parts of it. So it just really depends on the setting, what style of poster you use, I think.
Oh, we didn't. There was another slide. There's another slide, and that is the presentation. Hey,
It's the most important part.
the presentation is key. When you present, you talk to the audience. Don't talk to the poster. Face the audience. Be mindful of your nonverbal cues, meaning, look the audience in the eye. Use to vary the tone of your voice. Have energy. Have excitement. Have enthusiasm, and communicate that energy and enthusiasm, that passion for this poster. And then every once in a while, turn towards the poster. You could point at something like a figure, then turn back to the audience and talk to the audience. Practice, practice, practice. The more that you practice it, the more that it becomes more fluent. And last thing I'll mention is that when I go to the national ACP meeting and I serve as a judge there, it's sometimes it's very impressive. The residents who practice, they know their poster so well, they don't even glance at the poster. The whole time they're talking at you. They don't have any index cards or papers. They've memorized their poster. They memorized the laboratory results. It's like a script that they've memorized, and it plays well. It looks good, and that will help your poster presentation and the impression that the audience gets. Okay, so I'll stop there.
Fantastic. Thank you so much, Drs. Jarian and Chow. Let's move on to the next presenters then. So that's Drs. Podell and Deepak, who are going to talk about the research abstracts.
So Dr. Padal is going to do all the talking, and just like Dr. Chow, I'm going to do some cheerleading on the side.
Thank you, Dr. Deepak. Let me share my slides. Good evening, everyone. Can you see my slide? Well,
Yes.
Perfect.
yeah, I'm Ujjwal Kotal. I'm from St. Agnes Hospital, one of the chief here and one of the CRAP co-chairs. So I'm going to talk about ACP research abstract. So I'm not talking about the posters, but I'm talking about the abstract that you are submitting to through your program director to the ACP, so that it gets accepted and gets and you get the chance to present in the meeting. So let's start. What you should do in abstracts. So talking about the abstract eligibility, you can have original abstract which have never been presented in the past, or even if you have presented in other meetings, then those will be considered in this meeting. And however, you should think twice if you are trying to present your research or abstract in other meetings like ACC or AHA or some or endocrinology conference, things like that. So in that case, I think they might have their own criteria where they don't accept posters or abstract that has been already presented. So that just keep that in mind. And the next thing is, if you have abstract that have been published in the past, then you can still present. But if you already have a research which was already published in journals, you cannot submit that abstract for this presentation at this time. And other than that, you should review. After you finalize the abstract, you should send it to the program director, and it should be reviewed by your program director and signed by the program director before it is sent to the SAP. So let's take an example here of abstract. So when you are submitting abstract, it's very hard. Obviously, if you might have done a big research, you spend months to years working on a project, and now you have to tell a story within like 400, 500 words. So it's not that easy. And I think the most important thing is about big research is being able to tell your story in very limited words, very limited sentences, so that your message should be very clear. And when they are going through the abstract, and then they should have clear idea what you did and what are the results and what should we get from this research. So this is an example. So there are usually 4 components here. So in the beginning, you definitely have this title, and then you write the name of the contributors and their affiliations, including their CT. But you don't write in detail about their academic, affiliations or their academic degree and everything else. So don't write like assistant professor, blah blah, and everything else. You can just write MD or whatever their most relevant degree is. And the other thing is, the first paragraph is always about introduction or purpose, and the second one is methods, third one is results, and the fourth one should be conclusions. And all of this should be limited to about 500 words. When you are submitting to ACP, then I don't think you can submit more than 500 words. That's why it's not easy. It's easy to write long abstract, but it's not easy to write short abstract. So you might have to do multiple revisions before you submit. So the first part, the purpose of the study, you are trying to tell why did you do this study? That's the only one question that you're trying to answer, and try to limit it in one sentence if possible. And when you are describing method, just state the methods, like what you did or what is the methodology. And when you're talking about the results, just summarize the results. So you don't have to write all subgroup analysis and everything else. So what is the major results? So just describe that. And at the end, you'll have a conclusion, and do not try to write like conclusion with multiple sentences, and do not use phrases like the results will be discussed and things like that. So you can modify this organization depending on type of your research, but in general, it should follow the same format. So talking about the title and authors, you can take an example here. Depending on different conferences, you can either use all full sentences, or you can use first letter as capital. Other than that, you are using, all of you should be using single space, 10-point font, and try to keep the title brief. So it's not easy to keep the title brief as well. So just try to use, when you are reading, when someone reads your abstract, just try to make it look like you are trailing the story even from the title as well. So for example, when you are reading this title, then you know what they did or what they were trying to look into. And also try to make it engaging, as Dr. Christmas already told, that it's not when you are presenting big conferences, if your title is not catchy, or people might just skip your poster or abstract at all, so they might not even look into your posters. And you just put your name and only one degree, as I talked earlier, and you should list the name of the authors, institution, city, and state. Now talking about the introduction, so I could see from other abstract posters that some of them are trying to do detailed literature review here. So you are not trying to do detailed literature review, or you are not trying to do multiple citations or references on introduction section. So basically what you are trying to tell is you are giving information about the aim of the research, why you did this research. So you can use like max 1 or 2 sentences. In first sentence, you can give short background. In the second sentence, you can tell like why you did this research. For example, this was a research about rheumatoid arthritis, and in rheumatoid arthritis, they commonly use methotrexate. But on this research, they're trying to see if they added Janus kinase inhibitor, does it increase the risk of malignancy or not? So this was very clear. So even if you don't read the whole introduction section, even after reading this 2 or 3 sentences, you will have a clear idea what they are trying to do while reading introduction section. So the tips for writing abstract and research abstract is you don't have to describe in detail about rheumatoid arthritis, its pathophysiology, or like other medications and things like that. So just clearly state what you did in the research. Let's go to the next slide. And when you are describing methods,
Can I say one more thing about the introduction? And that last sentence really should be the objective. What is your objective of this study? So that's the last sentence. So really, exactly as you said, it should be really short, the introduction, 1 or 2 about the background, probably just 1, preferably maybe 2. And then that last sentence is really the objective of your study, what you sought to study specifically.
yeah, thank you, Dr.
All,
Yeah.
yeah, and the other thing I would say is what I was taught as a first year fellow was like, try to use as short sentences as possible. It's not English grammar here. It is all about conveying the message. So as little as possible words, those are very important. Like, so you can cancel a the or a to or things, as long as you're not changing the context of the entire introduction.
Thank you, Dr. The next slide is about methods. So on method section, you will describe the study design, what you did, the intervention, and how you collected data, and how you did the data analysis. So even on this section, so you will just describe was it a cross-sectional study, randomized controlled trial, or cohort study, or it was a retrospective study. Just describe as limited words as possible, and describe the intervention, like what you did. So for example, in the first example, you can see there were like 2 cohorts, and they have like different cohorts, and they clearly define that. And another example, they said that this was a systematic review and meta-analysis. So they did they did literature search, and they found like a couple of articles, and after that what they looked into that from those data. So you should describe the data collection, and at the end you can summarize how you did the data analysis. But you don't have to describe like you use Excel, or you use SPSS, you use R, or whatever program, or you can just describe the most important, or one of the most important thing that you used during the analysis part. And the next is result section. So result section, as we talked earlier, so you should clearly describe like how many your data point, your sample size, and if it is cohort study, then you can describe like how many years did you follow those patients for, or if it was cross-sectional study, when did you conduct those, and clearly describe your data or results. And the other point is, when you are describing your data, always try to use don't always put the numbers only, but you should always put like percentage or relative comparison as well. And you should use relative risk, or if you are using other tools of statistical significance, then put that. If there is confidence interval, you should put that as well. So for example, in this example where they let's take this first example. They followed up 17,000 service members for about 8 years, and they clearly described the traumatic brain injury and PTSD and depression, which were associated with this development of the OSA. And they clearly, and if you look into the data here, even if they have other ratios, they also describe the confidence interval. The 95% confidence interval is 2.09 to 2.74. So if someone has any doubt, or if they want to check if this data was really significant or not, even with these sentences, even with this very short information, then and they can clearly know the significance of the data. And that is but you don't have to go in detail about subgroup analysis or other secondary outcomes. Try to focus on the primary outcome if possible, until and unless secondary outcome is very, very important that you want to highlight. And the next,
And I would say here with those confidence intervals, I just read an abstract recently, and the resident kept putting p-values after each one of the, which is not necessary, right? When you have the confidence intervals, are telling you is it statistically significant or not.
and the next is conclusions. So when you're trying to state the conclusion, always state your own findings. So for example, in this first extract, so the addition of this JAK inhibitors to the methotrexate therapy, they were trying to see if it increases the risk of malignancy or not. So they found that it did not, it was not associated with the increased risk of malignancy. So that is the most important thing that you're trying to look into here. And the secondary outcome sometimes is, if it is very important, then you can add, but do not add if it is not that important. And the other important thing about conclusion is only state your own findings. So for example, if they found another research which, for example, if they in another research they found this addition was associated with increased risk of malignancy or even decreased risk of malignancy, then do not cite those things here in the conclusion, because those are not your own results. So just cite your own result only. So only state your own finding. And because you cannot make conclusion from other other studies here in the conclusion, you are just trying to present your own finding. And
One thing I would say also about the conclusion, I don't know how the others feel. Often I like to see a brief limitations of the study in the conclusion. That some people feel differently about that because you're very usually crunched with words. Yeah, I usually think that's thoughtful that the author put that in there.
yeah, I agree, Dr. Isman. Yeah. So for example, if there's any, if you think this study is generalizable or not, or if you did a study in very selected population, it might not be generalizable to whole country. Then in that case, you can clearly mention that because it might not be applicable to everyone. So that's about the conclusion. And overall, and the other thing is about abbreviations. So when you're trying to use abbreviation in abstract, try to use as minimum as possible. And if you're using a non-standard abbreviations, then try to limit their number. And whenever you're writing those abbreviations, try to explain it. And there is a standard book and format. You can find the online version, and then you can access this from your university or your institution's login as well. So you can refer to this book. The other thing is, whenever you're writing the name of the medications, or always prefer generic names. Do not write like Tylenol or something like that. If you always use generic name, because the proprietary name, you can only use proprietary name only if you don't have any other generic name, or if you are using it for the first time, and in that case you can use the proprietary names. And always try to use this metric system whenever possible, and always try to use standard chemical measurements like millimole and grams and things like that, and don't try to abbreviate it, because it might create more confusion. And citations, the good thing about research abstract is you don't need any citations. That's why I just wanted to put this slide as a reminder. And these are the examples of two nice abstracts. So if you read this abstract, then you can clearly see what they wanted to do, what they did, what was the methodology, results, and then the conclusion. And the only thing about this first research is they did not put the author's name and then their affiliations. So I also have one example of abstract from which I got from ACP. So if you take an example, now it's a known fact that seborrheic dermatitis is associated with AIDS. Now, going back,
Excuse me, Dr. Podell, I'm going to try and move us along a little bit quickly because I think we're running us just a smidge over.
so this is the last slide. So I just wanted to point out the important things here. So you can take an example how they clearly highlighted their findings. And just to add into that, so there is actually a checklist. If you go to ACP online, then you can just search a scientific abstract checklist. You can find a checklist, and you can use this checklist to make sure that you are following all the rules. That's all about my presentation. Thank you so much.
Thank you. It's a lot to squeeze in a short amount of time. I'm going to hold questions for this section for now, just to make sure we get the last presentation in, and then we'll be able to circle back and see if Dr. Deepak wants to add more or people have questions about that. Thank you so much, Dr. Podell. So our last section is Drs. Wiseman and Butani are talking about their research poster.
Hey, good evening, everybody. Can you guys see my slides? Okay, great. Thank you, first of all, to everyone who's presented before me. I'm pretty sure they've made my lives easier. Before I start, my name's Dr. Bhutani. I'm one of the assistant chief residents at Sinai Hospital, also a third year, and also one of the CRAP co-chairs. And I'll be making this presentation with Dr. Weissman. Dr. Weissman is the associate program director at MedStar in Baltimore, and he's been of great help with this PPD. It really made my life easier. Okay, so let's start. So my job is to tell you guys how to present effective posters and how to make them pop. So a lot of the sections were already described by Dr. Podell in how to present your abstract. So I want to start with saying, why do most posters fail? Common reasons the posters get ignored: they have too much text. We've discussed this. We've seen many examples of the posters having tiny fonts, a poor visual hierarchy. Like Dr. Chow mentioned on that one poster that just caught your eye, you would still wait and read that poster. A lot of the other posters, you'll be in a row of 10 people presenting side by side, and there's word overload at that point. So you're not gonna get your point through. The one important thing is there needs to be a clear take-home message. What is the reader gonna stay with? Otherwise, it's just gonna be one poster after the other and no clear take-home message. The abstract, the point is to get your point through to the audience, not to tell them the manuscript. That's what the manuscript's gonna be later. That's gonna be in the journal. That's gonna be for all your peers to review later. Right now, you need to take your message and like put it in the reader's head. So don't put all your manuscript onto the poster. This is a rule I read in one of the articles and I really liked, is the 45-second rule. First, what is the question of your poster? What is it answering? What is the method you used and what did you find? As a reader, why should I care? Does this change my clinical practice? Is this something I'm going to take with me and carry throughout my 30, 40 years of practice going forward? And then again, I'm going to keep repeating this, but what's the take-home message? Poster anatomy, like we've seen, the clinical vignette posters, the research posters are a little different. You'll have the title on top. It's very important to have an institutional logo and the author names there. Then there needs to be an introduction, which needs to be short. It needs to be 1 or 2 lines. Again, as previously mentioned, know your audience. Are you presenting at ACP? Are you presenting at the students' conference? Are you presenting at ACC? So are there going to be cardiologists there? Base your introduction and who's going to read it. That's how you're going to decide how in-depth you need to make it. Keep it 1 or 2 lines and keep it bullet points. Much easier, much more concise, looks better. Methods. If you can put in a diagram for your methods, that's easy to understand, easy to explain, much better than putting in text and making people read it. Because if somebody is at the conference, they probably have done research themselves or they know the methodologies. So if you just put in a figure or a diagram, easier to explain, poster looks much more pretty. Then discussion is not mandatory in all posters, but some posters, if it's valid to your poster, if you have something to explain or something to discuss, example, meta-analysis, RCTs, that you want to quote a previous meta-analysis that was something similar to yours, then you can use it in the discussion section. And conclusion, like previously mentioned, has to be short, 1 to 2 points and a strong message of what you're taking home. This is something that I wanted to bring up is when we are making these things, everybody tells you your font size needs to be this, it needs to be large and visible. So title, if you're making it on PowerPoint, 85 to 110 points is good. section headers 45 to 60 points, and your body text needs to be 28 to 36. When you make it this text, the slide itself will tell you you're running out of words, like you're writing too many words, because this would give you a smaller section. Some acceptable fonts always read the society's instructions. They generally give a font, which font you have to follow. Some of the safer ones are Arial, Calibri, Helvetica. And this is one of the posters I presented in my first year. And looking back, it's not a good poster because it does not have any good figures. It's too dense. The text is too small to read from a distance. So just something that I just want to give an example when I'm highlighting the readability of the poster. This is something that I didn't realize initially, but white space is your friend. It's not that your poster is too empty. It's comfortable. All the sections have their space. So let the sections breathe. Don't keep writing. You don't have to like use all the text. This is not an exam. This is not a 20-mark question that you have to finish. So keep going. In terms of figures are very important. But the thing that you have to remember is good figures matter much more than just adding more and more figures. So there are these two examples parallel to each other. If you look at the left one and you look at the right one, the left one's complicated, right? As the presenter, you're going to have to explain it. And the right one just looks simple. It's a bar graph that even a 6th grader can understand. So this was another thing I read on one of the articles. If you can't explain your figure in a couple of minutes, then the figure doesn't need to be there. It's not a good figure. Color and layout is another thing I think Dr. Jung spoke about. It does not need to be a work of art. It needs to be one main color and one accent, hopefully high contrast so that your text can be readable from a distance. And the layout needs to be the same across sections. So it maintains uniformity and it looks more professional. I'm going fast because we've spoken about most of these points already. So in terms of summary, when you've written your abstract, you already have an introduction, a method section, results, and a conclusion. But when you're presenting, it has to be a 60-second pitch. Because what you've written, what those 2 months of work that you've put into that abstract have gone into is what you're going to present. That 60 to 90 seconds of presentation, that's what's going to count. And that's what people are going to listen to. And if they're interested, they'll dig deeper and they'll see your presentation and your full manuscript later. So it has to be a 1-sentence question. Why is this poster relevant? Method in terms of as simple as you can. I know a lot of research methods are harder and you cannot fit them in 1 sentence. So maybe make it 2 sentences, but something that the reader can understand easily. 1 or 2 key results. At the end, 1 sentence, why this matters. Like Dr. Chow mentioned, if you're going to a conference, you probably have edited this poster 10 times or you've written the abstract multiple times. By the end, you will know what's written in it. It's your work, it was your patient or your research. So practice what it is. Practice in front of a mirror, practice to a friend, practice to your program director. That is what matters a lot. The way you speak about the poster, that's going to leave an impact more than what's just written on the wall. Some do's and don'ts. Like we mentioned already, know your audience. Know who you're presenting to. Tell a simple and straightforward story that's easy to follow. Be visually as clean as possible. Use good figures, not too many figures. Highlight your take-home message. One thing I think that we didn't highlight on yet is when you're presenting, you yourself, while writing the abstract, must have had some questions. So anticipate what the audience is going to ask you. Make a list of a few questions, 5 or 10 common questions that you think your poster is going to raise. Practice those questions because you don't want to seem unprepared about what's going to be asked of your work. Practice, practice, practice. This is everybody on this dais would keep repeating this because this is most important. Don't overcrowd your poster. Don't shrink text to add more text. And definitely do not copy paste your manuscript. These are some of the references that I used for this presentation. And I'm going to invite Dr. Weissman and we're going to go through a few posters, some examples from the...
Colleen, how much time do we have left?
We're just slightly over, but you're good if you maybe wrap it up in 2 or 3 minutes. Can you do it? Do you think?
Maybe I do one not so good one and we'll show maybe a previous winner.
Okay, I'll go to the not so good one first.
Okay. And not to say these are bad posters necessarily, just maybe a way that could be done a bit better. And here, I think to go through this very quickly, this was a pretty cool study. I'm not just saying X, I was part of it, but it eventually got published in a good journal. But from looking at this poster, I just want to go to the next poster. I don't even want to dive into this thing at all. I think Ram just beautifully said everything that this poster is not. We should be doing a lot of words, mumbled, jumbled. The tables themselves, are very busy, and you probably don't need this to have every characteristic of the patients listed in those tables. So anyway, very busy tables could be much more concise. If you can use a figure, it was preferred because you can get a little bit more information easier across with a figure, often in a table. I think that's all I got to say about that one. We could spend a lot of time with just
Yeah.
the agony of that.
This one also something bad, just to add, no institutional logo, too much text, like very little. The results can better be explained in terms the other RCT. This is a meta-analysis, so the other RCTs that they've included doesn't need to be on the abstract, can be on the manuscript. So could be much more concise. I'll go to a good example.
Yeah, and I always like to say the figure, table, whatever have you, that it should be centered on the research poster as much as possible. And then just the last few examples we have here are previous winners for the local ACP chapter. So just to give you an idea of kind of what previous winning research posters have done. Again, I think this, less cluttered. We're not going to get into the details of this study, but just a little more easier to digest. Let me go to another one there. Yep, that's a nice, again, with research posters, they're going to be a little more busier than often a vignette poster will be, just because you got a lot of data to share. So just be careful to not over data. Don't overdo the data. I would say that's a take home message I've seen over and over again. Don't overdo the data. You don't have to present every finding from your study. Just highlighted ones, the important ones. I think even this one, as nice as it was, and this was a winner several years ago, it probably could be much more concise than it ended up to be.
Yeah, I think I like this one because there was a simple conclusion, 2 points. Introduction was small, lots of white space. Even if somebody wants to read it, they can read the entire poster within 3 to 4 minutes. It's not gonna take a lot of time compared to the previous ones, which are very word dense and very difficult to understand.
Yeah.
If it was to explain this in 5 minutes, it would be very hard.
Be very difficult. Dr. Chow mentions about references. I have funny feelings about references on posters. I think if you have a QR code that leads you to the references, and that is a great way to use a QR code, I think, and take up less space.
Yeah, I think this poster did this well. On the bottom left, it had like emails if you want to reach out to somebody. If you have a QR code for like more data somebody wants to go to, then that's a good way to save space.
There's one thing I would say, that there are certain posters that you have to write your funding.
Yes.
So we have to remember that, so you can always sacrifice your references for funding.
Way more important. Thank you for making that point.
Definitely. Could I say one thing about the research abstracts that we learned the hard way this past year? As most of you know, probably when you submit a research abstract to a national meeting, some are free of charge and some come at a very substantial charge. And we had one resident submit, I think about just close to, it was 10, it wasn't quite 10, but it was close to 10 abstracts. So a very expensive, I think it costs us about $100 per abstract. And I don't think the resident realized that at the time of the submission. So be careful that some are free. I think CHEST is a free one, but ATS is I think $70, right? Along those lines.
Yeah, CHEST is also not completely free. It really depends, but ATS is definitely $70.
Yeah, I think the American Heart, all the big national conferences these days are charging these big fees just to submit. That's not saying you got it approved. It's just submission.
So national ACP is a bargain. It's $25.
That's great.
And of course, our
Local has no fee.
No worries, yeah.
Well, these were really wonderful presentations. Thank you so much to our presenters. I know that was a lot to just squeeze in, and I was cracking the whip on the time and rushing people through. So I really appreciate you jamming in as much knowledge as you possibly can. You did a fabulous job. We do have a few minutes left for questions, comments, things from the students and residents who are joining. Fire away. While we're waiting, I will again put in a plug for our local research and clinical vignette competitions. As I mentioned, they are free to submit. And we have the Williams Conference on Saturday, March the 7th, and the Residence Mulholland Muller Conference on Thursday, May the 7th. A lot of fun. You get to mix and mingle. There's talks and lunch and all sorts of good stuff. Speaking of expense, Dr. Wiseman, we also are really cognizant that often residents and students don't have a lot of money to print these on fancy cloth backgrounds. And it is perfectly okay for these meetings, our local meetings, to print them on using a regular printer on a sheet of paper and to tack those up. You will not be judged in the poster competition based on whether you printed on some fancy schmancy thing or you had excellent content on pieces of paper that you pasted up there together. So please don't feel like you need to spend a lot of money for the local ones. A lot of good practice, a lot of fun, and we'll give you a lot of feedback on your presentations.
And I wanted to make a comment. I've put in a poster that it was a case report poster that I presented to ATS. There is some formatting issue that was the ATS website, but kind of gives you an idea for the clinical vignette abstract, because I know we didn't cover that. So feel free to look at it and, get some information from it. So it is in there for you all to view and review. Yes, ATS is American Thoracic Society. Yeah. So I think y'all all did a phenomenal job. And just come and enjoy and learn
Mhm.
and participate. Definitely participate. Would love to see y'all to coming for the chapter meeting. There's a lot of great speakers, including the ACP president, Jason Goldman. We're going to have the Senator Lamb coming. This will be the first time we actually have local senators coming, and you learn about advocacy. It is phenomenal. It is worth attending. I've attended as much as possible since 2003 when I was a resident. I joined that time and I've attended nearly all the ACP meetings. So it's absolutely worth it.
If no other questions, I will ask you all to thank our presenters again. You all did a wonderful job, Drs. Chow, Bhutani, Weissman, Paudel, and Jung. Thank you so, and Deepak. Gosh, Janaki, how can I skip over you? My goodness. Thank you all so much for your wisdom. I think there's a few take-home lessons in the spirit of presenting an abstract. I think there's a few things that we hope that you are taking away from this. One is that your Maryland ACP loves you, and we're excited to help you develop this skill and coach you through it. Come to these meetings. It's a great way to practice and to learn how to do these things. Two, when you're thinking about giving your presentations, make sure that you think about what it is you want to communicate. It's not just telling a story. You got to have a punchline. What is it that you want the reader of this abstract or the listener of this presentation to walk away with? And make sure that you have delineated that really, really, really clearly. I think several of our presenters really harped on this. The number one cardinal sin on these presentations are small font and too many words. So as Dr. Wiseman said, say more with less. So I think that's another really important take-home message. And we are just really grateful that you all joined tonight. There will be a recording of this posted up on our YouTube channel. Mary Ellen, any last words?
No, other than come, join us at all of our activities, and you always have a good time with the Maryland ACP.
That's for sure. That's a good group. Thank you all so much. Have a good night.